Hello everyone, welcome to a new series, Treatment Options in Surgical Diseases. So firstly, we are going to see the treatment options in varicose veins. I'm not going to explain each and every treatment option. We are just going to have an overview of all the treatment options available in varicose veins. Okay, so we can divide, whenever we are learning about treatment options, we can divide them into three headings. So the first one is conservative, then medical, then surgical. Again, this surgical can be divided into open, minimally invasive surgery, then endovascular or endovenous. Both are same, right? So we'll see one by one. So first one is conservative. So where we will counsel the patient regarding avoid prolonged standing, then keep the limb in elevated position while lying down. Also, patient can go for something called stockings, compression stockings, graduated compression stockings. Okay, so for this classic regarding this stockings, there is an important classification by name British classification. I'll just write down here. So British classification, where there are three classes. So first one is 14 to 18. So I'll just write down here. Class 1 is 14 to 18 Hg. Second one is 14 to 17, sorry. Then next one is 18 to 24 mmHg. Class 3 is 25 to 35 mmHg. Okay, so this is the classification of compression stockings. So the next one is medical. So here we are going to increase the tone of the vein by giving certain drugs. What are the important drugs? So first one is calcium dobicelate. So tablet calcium dobicelate 500 mg BD. Second one is tablet diosmin. This is nothing but microflavonoids. So the mechanism here is that normally varicose veins, the tone of the vein is lost. So we are by giving these drugs, we are increasing the tone of vessel wall. Okay, that is the aim of medical treatment. Now coming to surgical treatment options in open. So again, open can be divided for either great saphenous vein. For short saphenous vein, there is nothing but saphenofemoral junction, SFJ and SPJ both, and another one is perforators. So whenever patient has got saphenofemoral junction incompetence, patient needs to undergo something called Trendelenburg operation. Trendelenburg, sorry, Trendelenburg operation. Whereas for perforator incompetence, there are two important named surgeries. So one is Cocket and Dodd subfacial ligation, where beneath the fascia we are ligating the incompetent perforators. Then there is something called Linton operation. You can remember L for Linton, L for linear incision. So, for example, if this is the leg, we will make a single long linear incision and we'll open the fascia. Beneath the fascia, you are ligating all the incompetent perforators. So, that is about Linton operation. Okay, right. Please understand one common question they will ask about Trendelenburg is that is stripping a part of Trendelenburg operation? The answer is no. Even without stripping, mainly we are doing in Trendelenburg operation the flush ligation. Only the flush ligation of saphenofemoral junction is called Trendelenburg operation. Right now, coming to minimally invasive surgery, this is mainly only for perforator incompetence we have. The option is SEPS, subfacial endoscopic perforator ligation surgery. I'll write down here. So, subfacial endoscopic. We are using endoscope to do this. Endoscopic perforator ligation surgery. Okay, so that is sepsis. Now coming to endovascular, again we have two subtypes. First one is thermal, where we are using heat energy. Second one is non-thermal. Non-thermal. So in thermal, we are using heat as a form of energy. The main aim of treatment of this varicose veins is that we are only dealing with the superficial venous system. To deal with the superficial venous system and to destroy it, we are mainly looking at only one important thing, that is deep venous system patency. If deep venous system is good, then you can go and do the surgical options with the superficial venous system. So here we are mainly using the heat energy to destroy the superficial venous system by occluding the lumen of the vein. So the options in thermal options are, so one is radio frequency ablation, second one is endovenous laser ablation. So here we are using laser. Here we are using radio frequency as the energy source. Then there is something called steam. So most commonly done is EVLA. Then coming to non-thermal, sclerotherapy, sclerotherapy. Then second one is glue, that is nothing but cyanoacrylate. And there is something called MOCA, that is nothing but mechanochemical ablation. Mechanochemical ablation. Last one is high intensity frequency ultrasound, HIFU. Rarely done. High intensity frequency ultrasound. So these are the overall treatment options in case of varicose veins. Thank you.